Question 1. A patient complains of a sudden, sharp pain in their chest, shortness of breath, and a feeling of impending doom. What is the immediate priority for the medical assistant? A. Document the symptoms in the patient's chart. B. Administer prescribed pain medication. C. Escort the patient to a comfortable waiting area. D. Alert the physician immediately and prepare for emergency procedures. Answer: D. Alert the physician immediately and prepare for emergency procedures. This question tests your understanding of urgent patient care and recognizing critical symptoms. The keywords sudden, sharp pain, shortness of breath, and impending doom are classic indicators of a potential myocardial infarction, heart attack, or other severe cardiac event. In such an emergency, the medical assistant's immediate priority is to ensure the patient receives prompt medical attention from the physician, as delays can have serious consequences. For instance, if a patient presents with these symptoms, alerting the physician allows for rapid assessment and intervention, potentially saving the patient's life. Always remember that life-threatening symptoms require immediate action and escalation to a healthcare provider. Question 2. Which of the following is the primary purpose of HIPAA? A. To regulate the cost of healthcare services. B. To establish guidelines for medical billing and coding. C. To protect the privacy and security of patient health information. D. To standardize medical terminology across healthcare facilities. Answer: C. To protect the privacy and security of patient health information. This question focuses on a foundational aspect of medical law, the Health Insurance Portability and Accountability Act, HIPAA. The keyword primary purpose directs you to the core reason HIPAA was enacted. HIPAA's main goal is to safeguard sensitive patient information from unauthorized disclosure and to give patients more control over their health data. For example, under HIPAA, you cannot share a patient's diagnosis with their family members without the patient's explicit permission. Always remember that patient confidentiality is paramount in healthcare, and HIPAA provides the legal framework for this protection. Question 3. When taking a patient's blood pressure, the systolic reading represents which of the following? A. The pressure in the arteries when the heart is at rest. B. The pressure in the arteries when the ventricles contract. C. The force of blood against the vein walls. D. The total volume of blood circulating in the body. Answer: B. The pressure in the arteries when the ventricles contract. This question assesses your knowledge of vital signs, specifically blood pressure components. The keyword systolic reading refers to the higher number in a blood pressure measurement. Systolic pressure is the maximum pressure exerted on the arterial walls when the heart's ventricles contract and pump blood out into the body. For instance, a blood pressure reading of 120/80 mmHg indicates that 120 mm of mercury is the systolic pressure, reflecting the force during heart contraction. Understanding this distinction is crucial for accurately interpreting blood pressure measurements. Question 4. The medical term for pain is A. Itis. B. Algia. C. Ectomy. D. Ulma. Answer: B. Algia. This question tests your knowledge of common medical suffixes. The concept being tested is identifying the correct suffix used to denote pain. The suffix algia is consistently used in medical terminology to describe pain, as seen in words like myalgia, muscle pain, or neuralgia, nerve pain. Understanding these basic suffixes helps you decipher unfamiliar medical terms. For example, if you see gastralgia, you would know it refers to stomach pain. Memorizing common suffixes is a key step in building your medical vocabulary. Question 5. When scheduling an appointment for a new patient, Which of the following pieces of information is most crucial to obtain first? A. The patient's preferred method of payment. B. The patient's insurance information. C. The patient's full name and contact information. D. The patient's medical history. Answer: C. The patient's full name and contact information. This question pertains to administrative tasks, specifically patient scheduling. The keyword "most crucial to obtain first" helps prioritize the necessary information. Before you can even begin to discuss insurance, payment, or medical history, you need to know who the patient is and how to reach them to set up and confirm the appointment. For example, if you schedule an appointment for John Smith but don't get a phone number, you have no way to contact him if the appointment needs to be rescheduled. Always ensure you have basic identifying and contact details right away when interacting with new patients. Question 6. A medical assistant is preparing to administer medication to a patient. Which of the following rights of medication administration must be verified first? A. Right time. B. Right dose. C. Right patient. D. Right route. Answer: C. Right patient. This question evaluates your understanding of medication safety protocols, specifically the rights of medication administration. The keyword "verified first" emphasizes the initial and most critical step in this process. Ensuring you have the right patient is paramount because administering medication to the wrong person can have severe, even fatal, consequences. For example, checking the patient's name and date of birth against the medication order prevents a mix-up if two patients have similar names. Always verify the patient's identity before proceeding with any other steps to ensure medication safety. Question 7. The term distal refers to a point. A. Closer to the midline of the body. B. Further from the point of attachment or origin. C. Towards the front of the body. D. Towards the back of the body. Answer: B. Further from the point of attachment or origin. This question tests your knowledge of anatomical directional terms. The term distal is a fundamental concept in describing the relative positions of body parts. It means farther away from the trunk or the point of origin of a body part. For example, in relation to the shoulder, your fingers are distal, while your elbow is proximal. Understanding these terms is crucial for clear and precise communication in healthcare. Question 8. What is the correct angle for performing a venipuncture on an adult patient? A. 90 degrees. B. 45 degrees. C. 15 to 30 degrees. D. 10 degrees. Answer: C. 15 to 30 degrees. This question assesses your practical knowledge of phlebotomy techniques. The concept is the correct angle for needle insertion during venipuncture. A 15 to 30 degree angle is ideal for most venipunctures on adult patients, as it allows the needle to enter the vein without going completely through it, minimizing the risk of complications. For example, inserting the needle too steeply might puncture both sides of the vein, while too shallow an angle might just scrape the surface. Mastering this angle helps ensure a successful and less painful blood draw for the patient. Question 9. When communicating with a patient who is hearing impaired, which of the following actions is most appropriate for a medical assistant? A. Shout loudly to ensure they hear you. B. Speak slowly and clearly, facing the patient. C. Turn away to avoid distracting the patient with your mouth movements. D. Write down everything you need to say. Answer: B. Speak slowly and clearly, facing the patient. This question tests your ability to provide effective and empathetic patient communication, especially with individuals with sensory impairments. The keyword most appropriate guides you to the best practice. Speaking slowly and clearly, while facing the patient, allows them to read your lips and pick up on nonverbal cues, which can significantly aid understanding. For instance, if a patient cannot hear well, watching your mouth movements can help them piece together words. Always remember to be patient and adapt your communication style to meet the patient's individual needs. Question 10. In the event of a fire in the medical office, what is the first action a medical assistant should take? A. Attempt to extinguish the fire. B. Evacuate patients and staff from the immediate area. C. Call 911. D. Close all doors and windows. Answer B. Evacuate patients and staff from the immediate area. This question assesses your knowledge of emergency preparedness and safety protocols in a medical office setting. The keyword first action indicates the immediate priority in a fire emergency. The primary concern is always the safety of human life, making evacuation the initial and most critical step. For example, before attempting to put out a small fire or calling for outside help, you must ensure everyone in immediate danger is moved to a safe location. Always remember the RACE acronym for fire safety. Rescue, alarm, confine, extinguish, with rescue being the absolute first step. Question 11. What is the correct needle gauge range for an intramuscular injection? A. 25 to 27 gauge. B. 20 to 22 gauge. C. 16 to 18 gauge. D. 30 to 31 gauge. Answer B. 20 to 22 gauge. This question evaluates your practical knowledge of medication administration, specifically intramuscular injections. The concept is selecting the appropriate needle gauge. A 20 to 22 gauge needle is generally recommended for intramuscular injections because it is strong enough to pass through muscle tissue while still being comfortable for the patient and allowing the medication to be injected effectively. For example, a flu shot administered into the deltoid muscle typically uses a 22 gauge needle. Choosing the correct gauge is essential for both patient comfort and proper medication delivery. Question 12. Which of the following best defines informed consent? A. A patient's agreement to treatment after being fully educated about the procedure, risks, and alternatives. B. A doctor's permission to perform a procedure on a patient. C. A legal document granting power of attorney to a family member. D. An agreement to pay for medical services received. Answer A. A patient's agreement to treatment after being fully educated about the procedure, risks, and alternatives. This question tests your understanding of a critical ethical and legal concept in healthcare, informed consent. The keyword best defines asks for the most comprehensive and accurate definition. Informed consent means the patient has received all necessary information regarding a procedure, including its purpose, risks, benefits, and alternative treatments, and then voluntarily agrees to undergo it. For instance, before a minor surgery, the physician will explain everything to the patient, who then signs a form confirming their understanding and consent. Ensuring informed consent protects both the patient's autonomy and the healthcare provider legally. Question 13. When assisting with a sterile procedure, which of the following actions would contaminate the sterile field? A. Touching the outside of the sterile package. B. Reaching over the sterile field. C. Speaking directly over the sterile field. D. Maintaining a distance of 1 foot from the sterile field. Answer B. Reaching over the sterile field. This question assesses your understanding of maintaining a sterile field during medical procedures. The keyword contaminate highlights actions that would introduce pathogens. Reaching over a sterile field is considered contamination because debris or microorganisms from your clothing or arms could fall onto the sterile instruments or area. For example, if you reach across the sterile tray to adjust a light, any dust falling from your sleeve will compromise the sterility. Always remember to move around the sterile field, not over it, to prevent contamination. Question 14. Which body system is responsible for the exchange of oxygen and carbon dioxide? A. Cardiovascular system. B. Digestive system. C. Respiratory system. D. Nervous system. Answer: C. Respiratory system. This question tests your basic knowledge of human anatomy and physiology, specifically the functions of body systems. The phrase exchange of oxygen and carbon dioxide is the direct clue pointing to the respiratory system. This system, which includes the lungs and airways, facilitates the vital process of taking in oxygen and expelling carbon dioxide from the body. For example, when you breathe in, your lungs take in oxygen, and when you breathe out, they release carbon dioxide. Understanding this core function is fundamental to comprehending how the body maintains life. Question 15. Which of the following describes the subcutaneous route of medication administration? A. Into a muscle. B. Under the tongue. C. Into the fatty layer just under the skin. D. Directly into a vein. Answer: C. Into the fatty layer just under the skin. This question tests your knowledge of medication administration routes. The concept is understanding what subcutaneous means. The term subcutaneous literally means under the skin, referring to the fatty tissue layer beneath the dermis. This route is commonly used for medications that need to be absorbed slowly, such as insulin or heparin. For instance, an insulin injection is typically given in the abdomen or thigh, just under the skin. Knowing the different routes ensures proper and safe medication delivery. Question 16. What does an EHR, electronic health record system primarily aim to improve in a medical office? A. Patient satisfaction with wait times. B. Efficiency, accuracy, and accessibility of patient information. C. The number of patients seen per day. D. The aesthetics of patient charts. Answer: B. Efficiency, accuracy, and accessibility of patient information. This question addresses the benefits of modern administrative tools in healthcare. The acronym EHR and the keyword primarily aim to improve direct you to the core advantages of electronic health records. EHR systems consolidate patient data, making it quicker for authorized personnel to access, update, and review information, which reduces errors and enhances coordination of care. For example, with an EHR, a physician can immediately see a patient's recent lab results from another department, rather than waiting for paper charts. EHRs are essential for streamlined and safer patient care. Question 17. A medical assistant is performing a urinalysis. Which part of the urine specimen collection process is crucial for preventing contamination? A. Collecting the first voided urine of the day. B. Instructing the patient on proper midstream clean catch technique. C. Ensuring the specimen is kept at room temperature. D. Using a sterile collection cup. Answer: B. Instructing the patient on proper midstream clean catch technique. This question assesses your knowledge of laboratory procedures, specifically proper urine specimen collection to avoid contamination. While using a sterile cup is important, The midstream clean catch technique is the key instruction that directly prevents external bacteria from entering the urine sample. This involves cleaning the genital area and collecting the urine midstream, allowing the initial flow to flush out contaminants. For example, if a patient doesn't clean properly or collects the first part of the stream, skin bacteria can skew test results. Proper patient education on this technique is essential for accurate urinalysis. Question 18. Which prefix means fast or rapid? A. Brady. B. Tacky. C. Poly. D. Dis. Answer B. Tacky. This question tests your knowledge of medical prefixes, which are crucial for understanding medical terminology. The concept is identifying the prefix that signifies fast or rapid. The prefix tachy dash is used in terms like tachycardia, rapid heart rate, or tachypnea, rapid breathing, clearly indicating speed. Understanding these common prefixes allows you to decode many medical terms, even if you haven't encountered them before. Question 19. Which of the following is an example of a nonverbal communication barrier? A. Speaking a different language than the patient. B. Using overly complex medical jargon. C. Maintaining poor eye contact and a closed-off posture. D. The patient having hearing loss. Answer C. Maintaining poor eye contact and a closed-off posture. This question focuses on effective patient communication and identifying barriers. The keyword nonverbal points to communication that doesn't involve spoken words. Poor eye contact, crossed arms, closed-off posture, or fidgeting can signal disinterest, discomfort, or defensiveness, which creates a barrier to open communication with a patient. For example, if you are explaining a procedure while looking at your notes instead of the patient, they might feel you are not fully engaged. Being aware of your own and the patient's body language is vital for building trust and understanding. Question 20. When preparing a patient for a 12-lead EKG, where should the V4 electrode be placed? A. Fourth intercostal space, right sternal border. B. Fifth intercostal space, midclavicular line. C. Fifth intercostal space, anterior axillary line. D. Fourth intercostal space, left sternal border. Answer B. Fifth intercostal space, midclavicular line. This question assesses your knowledge of clinical procedures, specifically correct electrode placement for a 12-lead EKG. Precise placement is crucial for accurate heart rhythm interpretation. The V4 electrode is placed in the fifth intercostal space, the space between the fifth and sixth ribs, at the midclavicular line, an imaginary line drawn straight down from the middle of the collarbone. This placement ensures the electrode captures electrical activity from the correct area of the heart, much like positioning a microphone correctly to pick up the clearest sound. Always double-check your anatomical landmarks to ensure the physician receives a reliable and accurate EKG tracing for diagnosis. Question 21. A medical assistant suspects a child patient is experiencing abuse. What is the medical assistant's ethical and legal obligation? A. Confront the suspected abuser. B. Document the suspicions in the patient's chart and inform the physician. C. Keep the suspicions confidential to protect the family's privacy. D. Report the suspicions directly to law enforcement without informing the physician. Answer B. Document the suspicions in the patient's chart and inform the physician. This question tests your understanding of legal and ethical responsibilities regarding suspected abuse. The keyword obligation refers to your duty as a healthcare professional. As mandated reporters, Medical assistants must document any signs of abuse or neglect and promptly report these concerns to the supervising physician, who will then follow established protocols for reporting to Child Protective Services or law enforcement. For instance, if a child presents with suspicious injuries, documenting observations and alerting the doctor is the appropriate action. You must prioritize the child's safety while following proper reporting channels. Question 22. Which link in the chain of infection is broken by practicing proper hand hygiene? A. Reservoir. B. Portal of exit. C. Mode of transmission. D. Susceptible host. Answer: C. Mode of transmission. This question assesses your understanding of infection control and the chain of infection. The concept is identifying how hand hygiene breaks the spread of pathogens. Proper hand hygiene, such as washing hands or using hand sanitizer, directly removes or inactivates microorganisms from the hands, thereby interrupting their mode of transmission from one person or object to another. For example, if you touch a contaminated surface and then touch a patient, your hands acted as a mode of transmission. Washing your hands breaks this link. This simple yet critical practice prevents countless infections. Question 23. What is the primary function of the small intestine? A. Absorption of water and electrolytes. B. Digestion and absorption of nutrients. C. Storage of bile. D. Production of digestive enzymes. Answer: B. Digestion and absorption of nutrients. This question tests your knowledge of the digestive system and the specific function of the small intestine. The keyword primary function highlights its main role. While other parts of the digestive system have important roles, the small intestine is where the vast majority of chemical digestion and nutrient absorption occurs. For example, carbohydrates, proteins, and fats are broken down into their smallest components and then absorbed into the bloodstream through the walls of the small intestine. Understanding this function is crucial for comprehending how the body obtains essential building blocks and energy from food. Question 24. A physician orders 500 milligrams of a medication, and the available medication is 250 milligrams per tablet. How many tablets should the medical assistant administer? A. 1 tablet. B. 2 tablets. C. 0.5 tablet. D. 3 tablets. Answer: B. 2 tablets. This question tests a basic pharmacology concept, dosage calculation. The concept is determining the correct number of tablets to administer based on the ordered dose and the available strength. To calculate this, you divide the ordered dose, 500 mg, by the dose per tablet, 250 mg/tablet, which equals 2 tablets. For example, if the doctor wanted 1000 milligrams and you had 250 milligrams tablets, you would give 4 tablets. Accurate dosage calculation is critical for patient safety and ensures the patient receives the correct amount of medication. Question 25. Which coding system is used to describe medical diagnoses? A. CPT, current procedural terminology. B. HCPCS, Healthcare Common Procedure Coding System. C. ICD, International Classification of Diseases. D. NDC, National Drug Code. Answer: C. ICD, International Classification of Diseases. This question assesses your foundational knowledge of medical coding systems. The keyword medical diagnoses directly points to the purpose of the ICD system. The ICD codes are used globally to classify diseases, signs, symptoms, abnormal findings, complaints, social circumstances, and external causes of injury or diseases. For example, when a patient is diagnosed with strep throat, an ICD code is assigned to that diagnosis for billing and statistical purposes. Understanding the different coding systems is essential for accurate medical record keeping and billing. Question 26. When preparing a urine specimen for transport to an outside laboratory, what is the most important step for a medical assistant to ensure specimen integrity? A. Place the specimen in a brown paper bag. B. Ensure the specimen is clearly labeled with patient information. C. Keep the specimen at room temperature. D. Transport the specimen within 24 hours. Answer B. Ensure the specimen is clearly labeled with patient information. This question addresses the critical aspect of specimen handling and integrity in laboratory procedures. The phrase, most important step, and specimen integrity highlight the necessity of correct labeling. Mislabeling or unlabeled specimens can lead to incorrect diagnoses, inappropriate treatment, and serious patient safety errors. For example, if a urine sample is sent to the lab without a name, the results cannot be reliably matched to a patient. Always double-check that all specimens are accurately labeled with the patient's full name, date of birth, and time of collection. Question 27. When changing a wound dressing, what is the primary reason a medical assistant wears clean gloves? A. To protect the dressing from contamination. B. To prevent the spread of microorganisms. C. To keep hands from getting messy. D. To provide warmth to the wound area. Answer B. To prevent the spread of microorganisms. This question tests your understanding of infection control principles during wound care. The keyword primary reason directs you to the main purpose of wearing gloves. Gloves act as a barrier to prevent the transfer of microorganisms between the patient and the medical assistant, protecting both parties from potential infection. For example, if you are changing a dressing on an infected wound, gloves prevent the bacteria from getting on your hands and spreading to other surfaces or patients. Always prioritize infection control when performing any procedure involving body fluids or open wounds. Question 28. The suffix ectomy means A. Surgical repair. B. Surgical removal. C. Surgical incision. D. Surgical creation of an opening. Answer B. Surgical removal. This question tests your knowledge of common medical suffixes. The concept is identifying the suffix that denotes surgical removal. The suffix ectomy is widely used in medical terms such as appendectomy, surgical removal of the appendix, or tonsillectomy, surgical removal of the tonsils. Knowing this suffix helps you understand the nature of a surgical procedure. For instance, if you hear cholecystectomy, you know it involves the removal of the gallbladder. Question 29. What is a key component of active listening during patient communication? A. Interrupting the patient to ask clarifying questions. B. Finishing the patient's sentences to show you understand. C. Giving the patient your full attention and providing verbal and nonverbal feedback. D. Planning your response while the patient is still speaking. Answer C. Giving the patient your full attention and providing verbal and nonverbal feedback. This question focuses on effective communication skills, specifically active listening. The keyword key component highlights the essential elements of truly hearing and understanding a patient. Active listening involves fully concentrating on what the patient is saying, both verbally and non-verbally, and demonstrating that you are engaged through gestures like nodding or making eye contact, and verbal cues like "I understand." For example, if a patient is describing symptoms, active listening ensures you don't miss crucial details by being distracted. Practicing active listening builds trust and ensures accurate information gathering. Question 30. Which position is recommended for a patient experiencing shock? A. Supine position with legs elevated. B. Fowler's position. C. Prone position. D. Trendelenburg position. Answer: A. Supine position with legs elevated. This question assesses your knowledge of emergency procedures and patient positioning for specific conditions. The concept is positioning a patient experiencing shock to improve blood flow. Elevating the legs approximately 12 inches while the patient is lying flat on their back, supine, helps return blood from the extremities to the vital organs, improving circulation. For example, if a patient is pale and dizzy after a fall, positioning them this way can help stabilize their blood pressure. This simple intervention can be crucial in managing shock until medical professionals arrive. Question 31. What is the purpose of an advanced directive, such as a living will? A. To designate a beneficiary for financial assets. B. To outline a patient's wishes for medical treatment in advance, should they become unable to communicate. C. To authorize a medical assistant to perform advanced procedures. D. To grant permission for organ donation after death. Answer: B. To outline a patient's wishes for medical treatment in advance, should they become unable to communicate. This question tests your understanding of medical, legal, and ethical documents, specifically advanced directives. The keyword purpose focuses on the primary role of a living will. An advanced directive allows individuals to make decisions about their future medical care, such as resuscitation or life support, and communicate these wishes beforehand, ensuring their preferences are respected even if they can no longer speak for themselves. For instance, a patient might specify they do not want to be put on a ventilator if they are in a permanent vegetative state. These documents empower patients and guide healthcare providers in difficult situations. Question 32. What is the most effective method for sterilizing heat-sensitive medical instruments? A. Autoclaving. B. Boiling. C. Chemical sterilization, e.g., glutaraldehyde. D. Disinfecting with alcohol wipes. Answer: C. Chemical sterilization, e.g., glutaraldehyde. This question assesses your knowledge of infection control, specifically sterilization methods for different types of equipment. The keyword heat-sensitive indicates that traditional heat sterilization methods like autoclaving or boiling are not suitable. Chemical sterilization, often using high-level disinfectants like glutaraldehyde, is the most effective method for achieving sterility on instruments that cannot withstand high temperatures without damage. For example, some endoscopes or specialized instruments require chemical sterilization. Knowing the appropriate sterilization method for each instrument type is crucial for patient safety and equipment longevity. Question 33. Which of the following is considered the basic structural and functional unit of all living organisms? A. Organ. B. Tissue. C. Cell. D. System. Answer: C. Cell. This question tests your foundational knowledge of anatomy and physiology. The concept is identifying the most fundamental unit of life. The cell is recognized as the basic building block from which all tissues, organs, and organ systems are formed, and it carries out all essential life processes. For example, a single nerve cell transmits electrical signals, while many nerve cells form nerve tissue, which then forms parts of the brain. Understanding the cell as the fundamental unit is crucial for comprehending how the body is organized and functions. Question 34. What term describes an undesirable or harmful effect of a medication that occurs in addition to its intended therapeutic effect? A. Therapeutic effect. B. Contraindication. C. Side effect or adverse effect. D. Indication. Answer: C. Side effect or adverse effect. This question tests your understanding of pharmacology terms related to drug effects. The concept is defining an unintended consequence of medication. A side effect, also known as an adverse effect, is any undesirable reaction to a drug that occurs at a normal therapeutic dose. For example, drowsiness is a common side effect of many antihistamines, even though the primary goal is to alleviate allergy symptoms. Understanding side effects is crucial for patient education and monitoring during drug therapy. Question 35. What is the primary purpose of a superbill, in counter form? A. To provide patients with a detailed explanation of their diagnosis. B. To document patient complaints and symptoms for the physician. C. To record services rendered and diagnoses for billing and insurance purposes. D. To schedule follow-up appointments for patients. Answer: C. To record services rendered and diagnoses for billing and insurance purposes. This question addresses administrative tasks, specifically medical billing documentation. The keyword primary purpose directs you to the main function of a superbill, also known as an in-counter form. This form is a crucial document used by healthcare providers to list the services provided during a patient visit and the corresponding diagnoses, which are then used to generate claims for insurance companies and bill the patient. For example, after a patient visit, the physician marks the procedures performed and the diagnoses on the superbill, which the medical assistant then uses for coding and billing. It streamlines the financial aspect of the patient visit. Question 36. What is the purpose of performing quality control, QC, on laboratory tests? A. To reduce the cost of lab testing. B. To ensure the accuracy and reliability of test results. C. To speed up the testing process. D. To train new laboratory technicians. Answer: B. To ensure the accuracy and reliability of test results. This question assesses your knowledge of laboratory procedures, specifically the importance of quality control. The concept of quality control in a lab setting is fundamentally about verifying that the equipment and reagents are functioning correctly so that the results produced are consistently accurate and reliable. For example, running known control samples with expected results helps confirm that the test system is performing within acceptable limits before testing patient samples. Quality control is essential for patient safety and for healthcare providers to make correct diagnostic and treatment decisions. Question 37. When assisting a physician with a gynecological exam, what is the most appropriate position for the patient? A. Supine. B. Prone. C. Lithotomy. D. Fowler's. Answer: C. Lithotomy. This question assesses your knowledge of clinical procedures and patient positioning. The concept is selecting the correct position for a specific medical examination. The lithotomy position, where the patient lies on their back with their feet in stirrups, is specifically used for gynecological and rectal examinations as it provides optimal visibility and access to the pelvic area. For example, a Pap test requires the patient to be in the lithotomy position. Knowing the appropriate patient position for various exams ensures patient comfort and facilitates the physician's work. Question 38. The root word cardio refers to: A. Liver. B. Heart. C. Kidney. D. lungs. Answer B. Heart. This question tests your fundamental knowledge of medical root words. The concept is identifying the organ associated with the root cardio. The root cardio consistently refers to the heart, as seen in terms like cardiology, study of the heart, or cardiovascular, pertaining to the heart and blood vessels. Understanding common root words helps you decipher the meaning of many medical terms. For instance, if you encounter cardiomegaly, you would know it refers to an enlarged heart. Question 39. A medical assistant is interacting with a patient from a different cultural background. What is the best approach to ensure effective communication and care? A. Assume the patient has the same health beliefs as you. B. Rely on stereotypes about their culture to guide your interaction. C. Ask open-ended questions about their health beliefs and preferences. D. Speak louder and slower, assuming language is the only barrier. Answer C. Ask open-ended questions about their health beliefs and preferences. This question addresses a critical aspect of patient communication, cultural competence. The phrase "best approach to ensure effective communication and care" highlights the importance of respectful and individualized care. Asking open-ended questions demonstrates respect, allows the patient to share their unique perspectives, and helps you understand any cultural factors that might influence their health decisions or treatment adherence. For example, instead of assuming, you might ask, "Are there any cultural or spiritual practices that are important to you regarding your health?" This approach fosters trust and leads to more patient-centered care. Question 40. In an emergency situation, if a patient is unresponsive and not breathing, what is the immediate priority for the medical assistant, assuming no advanced directives are present? A. Check for a pulse and begin chest compressions if none is found. B. Elevate the patient's legs to improve blood flow. C. Administer rescue breaths only. D. Call the patient's family for consent. Answer A. Check for a pulse and begin chest compressions if none is found. This question assesses your knowledge of emergency procedures, specifically the initial steps in a cardiac arrest scenario. The concept is recognizing the immediate priority when a patient is unresponsive and not breathing. According to current guidelines, checking for a pulse and immediately initiating chest compressions if no pulse is detected is the most critical first step in basic life support, BLS, for an adult. For example, if you find a patient collapsed in the waiting room, after checking for responsiveness and breathing, feeling for a pulse is next. If absent, start compressions without delay. Early and effective CPR is vital for improving patient outcomes. Question 41. Which of the following is considered subjective information in a patient's medical record? A. Blood pressure reading. B. Patient's chief complaint. C. Lab test results. D. Physician's physical examination findings. Answer B. Patient's chief complaint. This question tests your understanding of medical documentation and the difference between subjective and objective data. Subjective information refers to what the patient tells you about their symptoms, feelings, or experiences, which cannot be directly observed or measured by others. The chief complaint is always subjective because it's the patient's own words describing their main reason for seeking care. For example, "I have a sharp pain in my stomach" is subjective, while a blood pressure reading of 120/80 mmHg is objective. Distinguishing between these two types of data is crucial for accurate and comprehensive medical records. Question 42. What is the recommended duration for hand washing with soap and water to effectively remove most transient microorganisms? A. 5 seconds. B. 10 to 15 seconds. C. 20 seconds. D. 1 minute. Answer, C. 20 seconds. This question assesses your knowledge of fundamental infection control practices, specifically proper hand hygiene. The concept is the recommended time for effective hand washing. The Centers for Disease Control and Prevention, CDC, recommends washing hands with soap and water for at least 20 seconds, ensuring all surfaces are thoroughly scrubbed. For example, after coughing or before touching a patient, scrubbing your hands for the duration of singing "Happy Birthday" twice helps remove harmful germs. Consistent and correct hand washing is one of the most effective ways to prevent the spread of infections. Question 43. Which type of bone protects the brain? A. Vertebrae. B. Ribs. C. Cranium. D. Pelvis. Answer, C. Cranium. This question tests your basic knowledge of the skeletal system and its protective functions. The keyword "protects the brain" directly points to the cranium. The cranium, or skull, is a bony structure that forms the head and provides a sturdy protective casing for the delicate brain tissue. For example, if someone sustains a head injury, the cranium is the first line of defense against damage to the brain. Understanding which bones protect vital organs is a fundamental concept in anatomy. Question 44. What is the difference between a generic drug name and a brand, trade, drug name? A. Generic names are capitalized, brand names are lowercase. B. Generic names are protected by patent, brand names are not. C. Generic names are the official, non-proprietary name, while brand names are proprietary names given by manufacturers. D. Generic drugs are always more potent than brand name drugs. Answer, C. Generic names are the official, non-proprietary name, while brand names are proprietary names given by manufacturers. This question addresses a key concept in pharmacology, drug nomenclature. The concept is distinguishing between generic and brand name drugs. The generic name is the universally recognized, chemical name of the drug, whereas the brand or trade name is chosen by the pharmaceutical company and is often easier to pronounce and remember, like acetaminophen, Generic, versus Tylenol, Brandy. For example, a patient might ask for Motrin, which is a brand name, but the generic name is ibuprofen. Understanding this difference is important for accurate prescribing, dispensing, and patient education. Question 45. Before a patient's first appointment, what is the main reason for gathering demographic and insurance information? A. To assess the patient's medical history. B. To determine the patient's chief complaint. C. To create a patient record and verify coverage for billing. D. To introduce the patient to the medical team. Answer, C. To create a patient record and verify coverage for billing. This question relates to administrative patient intake procedures. The keyword "main reason" points to the primary objective of collecting this initial information. Gathering demographic, e.g., name, address, date of birth, and insurance details allows the medical office to establish an administrative record for the patient and confirm their insurance benefits, which is crucial for financial processing and billing. For example, if insurance isn't verified, the patient might face unexpected costs or the claim could be denied. Efficiently collecting this information ensures smooth administrative operations and financial clarity for both the patient and the clinic. Question 46. What do CLIA-waived tests signify regarding laboratory testing in a medical office? A. They require highly trained laboratory professionals to perform. B. They are complex tests with significant risk of error. C. They are simple tests with a low risk of erroneous results, performed by non-laboratory personnel. D. They must be sent to an outside reference laboratory. Answer, C. They are simple tests with a low risk of erroneous results, performed by non-laboratory personnel. This question assesses your knowledge of laboratory regulations, specifically CLIA, Clinical Laboratory Improvement Amendments. The concept is understanding the designation of CLIA-waived tests. These tests are specifically designed to be easy to perform and interpret, with minimal risk of incorrect results, allowing them to be performed in a medical office by medical assistants or other trained healthcare personnel without extensive lab training. For example, a rapid strep test or a urine pregnancy test are common CLIA-waived tests. This designation helps ensure quick and accessible patient care while maintaining quality standards. Question 47. When performing spirometry, what specific instruction should the medical assistant give to the patient? A. Take short, shallow breaths. B. Breathe normally for the entire test. C. Inhale deeply and exhale forcefully and completely. D. Cough frequently during the test. Answer, C. Inhale deeply and exhale forcefully and completely. This question tests your knowledge of clinical procedures, specifically patient instruction for spirometry. The concept is eliciting the correct respiratory effort for accurate lung function measurement. Spirometry measures lung capacity, and to get a reliable reading, the patient must take the deepest breath possible and then exhale all the air from their lungs as quickly and completely as they can. For example, simply breathing normally would not provide the necessary data for lung volume and flow rates. Clear and precise instructions are essential for obtaining accurate test results. Question 48. What does the abbreviation NPO mean in a medical context? A. No pain observed. B. Nothing by mouth. C. New patient order. D. Normal physical examination. Answer, B. Nothing by mouth. This question tests your knowledge of common medical abbreviations. The concept is understanding the meaning of NPO. NPO is a Latin abbreviation for nil per os, meaning nothing by mouth. This instruction is often given to patients before surgery, certain medical procedures, or specific diagnostic tests to prevent complications like aspiration. For example, a patient scheduled for surgery might be told to be NPO after midnight. Knowing this abbreviation is critical for patient safety and compliance with medical orders. Question 49. When a patient becomes verbally aggressive and raises their voice, what is the most appropriate initial response for the medical assistant? A. Yell back to assert control. B. Ignore the patient and walk away. C. Maintain a calm tone of voice and empathetic demeanor. D. Threaten to call security if the behavior continues. Answer, C. Maintain a calm tone of voice and empathetic demeanor. This question addresses patient communication in challenging situations. The keyword most appropriate initial response guides you to de-escalation techniques. When a patient is aggressive, remaining calm, speaking in a low, even tone, and showing empathy can often help de-escalate the situation and prevent it from worsening. For example, saying, "I understand you're upset. How can I help?" while keeping your voice steady can be more effective than mirroring their anger. Your professional demeanor can significantly influence the patient's behavior and the outcome of the interaction. Question 50. A patient has a second-degree burn on their arm. What is the immediate first aid action a medical assistant should take? A. Apply ice directly to the burn. B. Break any blisters that have formed. C. Cover the burn with a dry, sterile dressing. D. Cool the burn with cool, not cold, running water. Answer D. Cool the burn with cool, not called D, running water. This question assesses your knowledge of emergency preparedness, specifically immediate first aid for burns. The concept is the proper initial treatment for a second-degree burn. Cooling the burn with cool, not called D, running water for 10 to 20 minutes helps to stop the burning process, reduce pain, and minimize tissue damage. For example, placing a burned arm under a gently running cool tap is more effective and safer than applying ice, which can cause further tissue damage. Prompt and correct first aid can significantly impact the healing process and patient comfort.